So you do a lot of dental implants in your office, and you have one of these centers, I guess, how it's normally done is you go to one place that does the implant, another place that puts the teeth on top, and you do it all right there.
Absolutely.
Is that
yes,
right?
We do. Yes,
and
we
you
do.
even have your own lab.
Yes, we do.
Okay. Now, if somebody goes to you, they're either wearing a denture or you can't save their teeth, a full mouth of extractions. Okay.
Yes.
What are their options when it comes to dental implants at your center?
Dental implants really opens the door to a whole range of possibilities for these patients, which is wonderful. I mean, you can start with the lower, you can get 2 implants and a denture that snaps in and snaps out.
Okay.
Okay, locks in real nice and solid. You can eat whatever you like. Or you can add a couple more implants. You can add 2 more in the back. 4 implants. It's like a chair with 4 legs. Very solid. It's not going anywhere. You can eat steak with it. You can bite into an apple right away.
No more adhesive or anything like that?
No more adhesive. If you're wearing a denture and you have 4 implants and they lock in and lock out, or they snap in, snap out, whatever you want to call it, you can get rid of the palate, the plastic. You know, you're drinking wine.
For the upper?
For the upper or the lower.
Okay.
It works great. It works wonderfully because these patients are just shocked that I can take the palate out immediately on their own denture. They come in with their own denture that they've worn for 10, 5, God knows how many years. And then I put 2 or 4 implants and I turn it into a snap in, snap out. I get rid of the palate.
Is that right? Okay.
And they're having hot soup. Okay. All of a sudden they realize, wait a minute, this soup is oversalted.
They can taste things again.
You know why? Because they can taste things again. Yes, the palate was preventing them from tasting. They're drinking wine and the wine tastes so much better. Okay? They're eating a toast and the toast, the paninis, they're amazed at what they've been missing with their food. With the snap-in, snap-out dentures, there's some maintenance involved. Okay? You need an adjustment every 6 months to a year. Okay? Sometimes there's gaskets that lock onto the implants that need replacements. Sometimes the denture needs to be relined.
So there is some maintenance to the snap in, snap out.
There is some maintenance to there.
Okay.
And so you have to be aware of that going in. So the next level up would be a brand new set of teeth that don't come out. I call them teeth. In fact, I call them better than your own teeth because they don't get cavities.
All right.
They don't need deep cleanings. They don't need flossing and all that. You just come in every 3 months. I do tell my patients, when you get teeth that don't come out, I tell them, listen, you're getting the Cadillac of all options. They're going to serve you, they're going to feel better than your own teeth ever felt to you. You just got to maintain them. So yes, you do have to come in a little bit more frequently for me.
So do like a 6 implants on the
6
lower,
implants,
a full arch of teeth, and they're locked in?
They're locked in. They never need to come out. And you can live your life like you've never lost your teeth again.
And on the upper?
And on the upper.
Same thing?
Absolutely, same exact thing.
And the roof of the mouth is not covered?
Not covered. Done in one day, Randy, under one roof.
How soon can you eat? Okay, so person comes in, no teeth. And you told me this. They can walk in on the day of the actual procedure.
Yes.
Walk in with no teeth, walk out with upper and lower teeth that don't come out.
That don't come out.
Is that possible?
Absolutely.
Does it happen?
Absolutely.
Okay.
We do it all day, every day. And it's amazing because once they go home, I mean, of course, there's a little bit of, some preoperative planning has to go in. I mean, when you're talking about fixed teeth that don't come out, there's some planning stages. It's kind of like any kind of...
Like a few appointments before it starts?
Yes,
okay.
Because we're fully guided. We're doing it.
What does that mean, guided?
Guided means we take some scans of your smile. We take a scan of your face, we take some pictures, and that's where I was telling you before is where we design your smile the way you want it. I had this one lady come in, okay? She told me that she really loved her smile when she was 18 years old. Okay. Can you believe that? And she brought me her photographs from when she was 18, and she's showing me the photographs, and she says, I want my old smile back. And we gave her her old smile back. And that's possible with digital dentistry. We are experts in digital dentistry, or we like to think we're experts in digital dentistry, I'll say that. But we're able to do that where we can actually show her a simulation of her smile and show her her photograph from when she was 18 and say, okay, do you like it? We've done what you've asked, and she's amazing.
So no more dentures?
No more dentures, no more dentures. No more dentures that need to come out, that need to go into a glass of water at the end of the day, that need to be hidden from your spouse, or that you need to run away from a restaurant table just so you can clean it out. Bad breath is associated with dentures.
How old can you be to get this brand new set of teeth supported by dental implants?
Age isn't a barrier, Randy. I mean, if you think about it, people, my patient, I just finished rehabilitating an 89-year-old. She's 89, and all she wanted for her 89th birthday was her teeth back. She wanted her teeth back, and she wanted a celebration with all her family, all her kids, her grandkids,
Nice.
her great grandkids, and they had a big cake for her, and she's smiling and eating the cake without any hesitation because she's not worried. You know, you want to blow out the candles on the cake, not blow out your dentures while trying to blow out the candles.
Yeah. So no more dentures.
No more dentures.
So the implant surgery is not more, they're not more likely to fall out if you're 90 than if you're in your 40s or 50s?
Of course, the cases might be a little bit more difficult. There may be certain considerations that have to be taken into while planning the surgery, because as
you'll work with their doctor and things like that.
We have a group of specialists that we work with. We have an anesthesiologist that we work with. So safety is big in our practice. The reason I have the anesthesiologist is because when we're doing these procedures on people, be it 25, be it 55, be it 80 years old, I want to devote 100% of my time to my patients that I'm trying to rehabilitate. I don't want to worry about them. I'm not worried about managing their heart rate, their blood pressure, their breathing. You know, so I have a dedicated anesthesiologist
on all these cases.
On all of these cases, they're focused on making sure the patient is fine, so that when I'm done with my procedure and the patient wakes up, a lot of times these patients don't even remember. They go home and they're like, "Oh, I forgot my appointment." No, they don't even remember that the work was done, that they already have their new smile. It's unbelievable.
So you fantastic. Say husbands, wives are doing it together? I mean,
Absolutely.
I think you showed me a photo earlier.
Of two lovebirds,
the wife
yes.
does it
High
first,
sweethearts.
And then the husband comes in.
She loved it so much, and he was so impressed.
And their only option was dentures.
Yes.
And you gave them their teeth back.
I gave them their teeth back.
Is that what everybody wants? Like teeth that don't come out? Because I know you do the snap in, snap out.
Yes.
But if they spend a little bit more, they get permanent teeth that don't come out.
Permanent teeth that don't need to come out. I mean, that is the best way to go, Randy. I mean, imagine ourselves, if I lose a tooth, or if I lose multiple teeth, would you want to wear a set that goes in and out? Wouldn't that cramp
That's a good
your
point.
lifestyle?
No.
You know, people are more and more active in this day and age. People are going skydiving. People are going, you know, bungee jumping. You know, they're doing all of these activities, and more power to them. They have the energy to do it. You know, when you're 40,000 feet in the air jumping out of a plane, you don't want to worry about your dentures flying out with you. You want a set that is fixed, that is worry-free, and that lets you do what you want to do, lets you be who you want to be, you know, and not be that person who's always worried about, what am I going to eat next? How am I going to eat at this party? I don't want to go to the restaurant. You know, people go out at any age. Like I said, age is not a barrier, because I have a lot of these patients in their 70s and 80s, and they're playing bocce, they're playing pickleball with their friends. And then after the game, the friends are all going to a restaurant, okay, or they're going to a bar, and you're making excuses. You know, you're like, oh, I got to water the plants, or I got to walk the dog. No, you don't.
Because you don't want to eat in front of your friends.
You don't want to eat in front of your friends. You know, so you make an excuse so you can go home and eat mashed potatoes. No, no more dentures. Fixed teeth liberates you to go out and have fun with your friends, to enjoy your time with your family and your kids and grandkids, and eat what you want to eat without it. You're not looking at a menu anymore.
But can you eat, like, let's say, a carrot with your front teeth, or do you have to be careful?
Absolutely.
You can eat whatever you want.
Eat whatever you want.
Like
eat
nuts?
A steak, nuts, almonds, pistachios. Okay, I don't know, walnuts.
Do they tell you eating stories? Do they say, Doc? I mean,
all the time. The lady the lovebirds that I spoke about earlier.
Husband and wife. Okay.
Husband and wife team. You know, her desire was to eat a salad with some cranberries and nuts in it, and she can do that, and that is just liberating for her. She's like, okay, you know, I can eat what I want to eat. And the husband, he wants to eat steak. And he actually did right after the surgery. Of course, he cut it up into small pieces. I tell all my patients,
take it easy at first.
Take it easy at first. You know, you got to learn to crawl before you walk and walk before you run. Okay, don't go out and go crazy on everything just because you have your fixed teeth right after surgery. But yes, there's a learning curve to it. You have your new smile back. You got to realize, Randy, these people haven't had their teeth in years, 7, 8, 10, and now all of a sudden you give them their teeth back. You know, there is going to be some adjusting to it. You know, they're going to need some adjustment. They're going to need to get used to the new bite, to get used to the new smile. Muscle memory is different when people are using cutlery. So I tell patients, listen, take it easy. They're not going anywhere. They're your teeth. They're not coming out.
So no more dentures.
No more dentures.